You clicked on this video because you might have been diagnosed with endometriosis and you want to get pregnant and are wondering if it's even possible. Or maybe you don't have a diagnosis yet, but you've been experiencing some of the endo symptoms that you've heard about, and you're wondering, how could you know if you actually have it? Well, in this video, you're going to learn what endometriosis is, how to diagnose this, and what you can start to do right now to address it. If you're new here, welcome to FertilityTV. My name is Dr. Mark Sklar, and I'm the fertility expert. What you are about to learn is coming from my 21 years of experience as a fertility coach, helping couples from all over the world. So let's get started. But before we do, I created this free guide called the Fertility Foods Guide, where you get a fertility-approved shopping list and some recipes that can help you to get started on your journey. I'm gonna leave that link in the description below so you can download it for free. So now we can actually jump into it. Okay, so the first thing we need to do is understand endometriosis. And what it is, well, to begin with, endometriosis is typically a chronic condition. It's not something that's going to be acute, although you might start to feel it and think, oh, this is something new, and think of it as acute. But in general, it's a chronic condition. It occurs because tissue that's similar to the lining of your uterus, the endometrium, grows outside the uterus. So you might be asking, well, how does it actually get there? Well, the belief is, but we're not 100% sure, the belief is that at some point the tissue from the endometrium, from inside the uterus, actually made its way outside the uterus into the pelvic cavity or throughout the torso of the body. You can actually find that tissue anywhere from the pelvic region, anywhere in the pelvic region, on your bladder, on your intestines, all the way up to your nasal passages. So much though that some women, when they menstruate, actually bleed from their nose. That's right. Now those are extreme cases, but it is possible. Okay, so what we believe is that the way that tissue makes its way into the pelvic cavity and anywhere else is that the blood has backflowed through the fallopian tubes and makes its way out of the tubes themselves into the pelvic region. But again, we don't entirely know, okay? So once that tissue is there, you start to have symptoms. Those symptoms vary, and they vary based on severity. So how much tissue is there and how much symptoms do you have from those tissues is how we grade the stages of endometriosis. And those stages are graded 1 through 4, 1 being the least amount, 4 being the greatest, the most severe. And some of you might even have what's called silent endo, meaning you don't have symptoms, but you do have endometriosis that's impacting your reproductive health. The most common symptoms to experience are pelvic pain of some sort in some varying degree, right? Meaning pain in the uterus, in the ovaries. You can even have pain with intercourse. You could have heavy periods. You could have pain on your bladder and intestines that impacts your ability to urinate or have a bowel movement and can cause pain with either one of those. Another symptoms that I find that many of you might have, it might be the first thing you really notice, is spotting before you bleed, before your menstrual cycle. So you might have some light spotting 1, 2, 3 days before you actually start your bleed, and that could also be an indicator that you have endometriosis. Now, that could be there for a lot of reasons, that last part, the spotting. So I don't want all of you who spot before you bleed to think you have endo, but it's definitely something that we want to consider and hopefully rule out. So I just mentioned ruling it out. Ruling it out is part of the diagnosis process, so we're either ruling it in or ruling it out. So this comes back to how do we know, how do we diagnose it? The most accurate way to diagnose endometriosis is through a laparoscopy, otherwise known as a surgery, okay? Where they make 3 small incisions on your low abdomen so that they can look inside and see if they see what we call chocolate cysts, which is what is reminiscent of endometriosis. That's that tissue I was talking about, okay? So that is the most accurate way to diagnose it. It's also can be used as treatment because if you go in and you visually see it, then you could start to remove it, okay? 2 other ways that it can be diagnosed, but these are more diagnostic and not treatment, where the benefit of the lap is that you get both in one. Okay, but it is a surgery, so it's something to consider. You can have a blood test done. It's looking for a cancer marker, okay, CA125, and that can mean that you potentially have it. So it's not my favorite way to diagnose it because it doesn't definitively tell you yes or no. It says, okay, you do or you do not have this marker, and it is positive or it's not, but that doesn't necessarily tell you if you do or you don't have it. If the marker is negative, doesn't mean you don't have it. And if the marker is positive, it doesn't mean you do have it. You do have to still look a little bit deeper. But the nice thing about it is it's not invasive. And the last way that you can test for it is another test called a Receptiva DX test. This is a biopsy of the endometrium. So this is not looking outside the uterus. Okay, this is looking inside the uterus to see if you have the inflammatory markers that are positive and tell you that you do have endometriosis. So you can absolutely do that. And that would be a reliable way to test it. The negative is that's typically only done at an IVF clinic. So most OBGYNs do not do this test, okay? And then once you do that test, then how are you gonna address it? So let's just say it comes back positive, then what? The two main treatments on the medical side of things are surgery, which we just talked about, the laparoscopy, which is why the lap is so valuable because it's both diagnostic and treatment. Or you can use medication like Lupron, which will suppress your hormones, cause you not to have a cycle for a minimum of 2 months, if not a little bit longer, to hopefully dampen the tissue and the inflammatory response and the endometriosis and allow you to try to conceive. That last option of medication and Lupron is often done in conjunction with IVF because they would rather not do surgery and they're really focused on what's going on inside the uterine cavity. And so that treatment of Lupron would be appropriate in that situation because then we don't have to have surgery and delay things longer. We don't have to cause some scar tissue. There are side effects with the Lupron, so it's not, a perfect scenario, but it does help in terms of time frame and moving forward with the IVF process, or in this case, the transfer process. If you are going through IVF, that testing and then that treatment would be done after you've retrieved your eggs and have embryos for transfer and before you transfer. It'd be done in that in-between time. Now, surgery is always still an option like we talked about. The negative side of that is you might have to do it multiple times, but hopefully not. And you could develop scar tissue and most likely will develop scar tissue if you do have that procedure. What is endometriosis? How do we view it? From a natural perspective, we view it as an inflammatory response and an immune response. So then we want to support you in that way. So when we're looking at making choices through lifestyle and through diet, we want to do that through the lens of inflammation and immunity. So anti-inflammatory and immune supportive, okay? So what are you going to do? What are the foods? I bet you most of you can actually think of that, right? So through diet, you want foods that are low in sugar, good quality foods. They don't cause an inflammatory response. So all fried foods you don't want, sodas, really sugary foods, processed sugars, processed foods. We want to get rid of that. We want to be as healthy as possible with as good quality food as possible, okay? And we also want to increase our antioxidants as well. So that's how you would approach it from a dietary perspective, okay? Stress management. Stress causes inflammation. Stress impacts the immune system negatively. Lack of exercise or too much exercise does the same thing. So we want to have balanced exercise. We want to have good stress management techniques and tools. We want to have good, healthy sleep habits. All the foundational things that we always talk about are going to make a huge, huge difference for you in this place. And that's why you have to make sure you work on those foundationally, because that's going to be supportive all the way through. Then if there's any hormonal issues, often there are some hormonal issues as you have endometriosis. We need to run some labs to see what your hormones look like. And then the treatment or support for that is going to be very focused on what your specific labs show for you as an individual, not what they do for everybody else. So if you've heard somebody has too much estrogen, don't take the assumption that you have the same thing. Test it and find out, okay? And test it at the right time of the cycle. If you find out that you have thyroid issues or other hormonal issues, or sorry, if somebody else has that and that's what they had to do to support their endometriosis, don't make that assumption for you. Get tested so that you know how to support yourself hormonally appropriately, which is not going to be the same as what other people will do. A couple other things that I want to point out. I have seen through my 21 years that everyone who has endometriosis has some sort of digestive issue that needs to be addressed. Everyone doesn't have the same digestive issues, but they do have some sort of digestive issue that needs to be supported. So at the root cause, I find digestion is a key piece that needs to be addressed, okay? Not to mention that you heard me talk earlier that we believe that there's an immune component to this. Well, your immune system starts in the digestive system, so we need to make sure that your immune system is supported properly, and to do that, we need to support your digestive system so you have good, healthy, functioning digestive function, okay? So that's a key piece that I want to bring out. Another key piece, this is typically long-term management. With endometriosis, it's not typical that you are just going to get rid of it and it's never going to come back. The only times where I've seen that potentially happen is once you have children, that afterwards the endo doesn't seem to be the same. It doesn't mean it's gone, but it doesn't seem to be the same and can be much less. But in general, I want you to have the mindset that this is long-term management and that taking Lupron or doing laparoscopy is not going to get rid of it forever. Okay, and it's something that you're going to have to be mindful of. And if you do those things and then you're not living a good lifestyle like we talked about, you're creating an environment that's going to be more conducive for the endometriosis to return and thrive. Okay, and last but not least, work with the right person to get you the support that you need. In this case, I believe it's actually a combined effort, an integrative effort. Okay, whether you're working with your OB or your fertility doctor or even a surgeon, they're going to handle one aspect of it, but they're not going to handle the natural side of things, the herbal side of things, the coaching side of things that I do for couples. And so I believe for endometriosis, we need a combined effort, an integrative effort between two sides of the coin to get you the results that you're looking for. Okay, so now I'm going to leave you with this video so you can keep learning more about how stress can impact and affect your fertility. And if you want me as your fertility coach, remember to apply to qualify for the whole program using the link in the description below. And until the next video, stay fertile.